All right, so we are episode 20 today. Who would have thought we'd make it to 20 episodes? How about
I
that?
don't know. That's for sure. That's like 6 months we've been podcasting. I'm waiting
Yeah.
Spotify. I'm waiting for that Rogan deal. I'm waiting for that 100 mil.
Yeah, there was something about that in the news the other day. Apparently Spotify staff were protesting about the fact that they couldn't edit the podcast or something. Was that right?
There was a couple episodes where he said some, and again, I never listened to episodes. I know as much as you from just reading articles of him. There were some things that he said that were apparently, right, sources tell me, were transphobic. And so Spotify employees were protesting to get those select episodes pulled off of them. Because they'd already pulled a couple episodes, like they pulled one with Alex Jones, and he's like a right-wing conspiracy theorist. They pulled a couple with Chris D'Elia, who's got outstanding allegations about basically pedophilia. So they're like, yeah, we're fucking protesting that stuff. That's just proves that you shouldn't fucking, don't hire any dweebs. If you ever run a company, don't hire any dweebs. Here's my professional advice for people listening out there that have a business. Don't worry about anything except, do you feel like you can teach this potential employee the necessary skills? And do you like this person? And can you spend time with them? That's it. That's all you got to worry about when you hire. Like, you can teach anybody anything. It's not rocket science. If I had enough time, I could teach somebody who'd never even done a lick of soft tissue work. You give me enough time, I could teach them how to do what we do. They're not going to be as good as me, as fast as me, but that's it. Just hire people that you like. Worry about everything you later, because a bad employee can fuck you.
Yeah, this is where we're very lucky, I think, because we're, very small shops, small operations, at least at the moment. So we do get to enjoy that, and we get to retain that level of control, which is something that I love. Yeah, I've worked in those big environments before, and you don't get to choose who you work with. You just get thrown into that melting pot, and it's a social nightmare a lot of the time.
There's a lot of people with a lot of opinions on things, and it's yeah, I don't know. The more you hate yourself, the more you're going to look to try and change the world. So I'll leave it at that.
Well, we're not being censored here on the Centenarian Project, so we get to just let it rip. So today we're going to come back to something that has, I guess, touched both of our lives at different points in time. For me, it's something that I've had a fair bit of experience with over the last few years. I'm kind of free of that at the moment for the most part. But it's definitely something that has really shaped a big part of my journey for a few years now. It's something that has just recently crept up on you a little bit. And this is a huge problem for a lot of people. It's something that I think the stats are about 85% of the population will experience this at some point in time. And a large percentage of that will experience recurrent episodes of that. We know that globally this is a big problem. We know that globally it's not really getting fixed, in the sense that percentage is not coming down. So, it's one of our goals. It's one of our missions to do it better. What are we talking about today, Dr. Mike?
Yeah, last Tuesday, I irritated a disc of mine. I was doing some back squats. I was working up to heavy weight. It was early in the morning, probably 6:15, right when those discs are nice and juicy and plump. And I probably hadn't had a flare up in about probably been 4 or 5 years in the lower back. And I had that little disc irritation, got to the bottom of the squat, pushed myself out of it, stood up at the top, and I was like, there it is. And it was just one of those things. I tried to do another rep, felt really weak after it, racked it up, and called it a day. So it's been a while since I've had that experience. I think the combination of a lot of the sitting that I've been doing, just with the volume of computer work that I've been putting myself under, between editing videos and responding to patients and doing nutrition check-ins and keeping up on social media. And, you know, obviously this one's for pleasure, but, you know, playing a video game and things like that. I think I had a little bit more going on in there than normal. I have been getting it treated to the tune of like every other week. I've been getting some manual adhesion release on the lower back, and I overloaded it, compressed the crap out of it, irritated it, and yeah, it was a special couple of days for me.
I can 100% understand exactly what happened, because I did the exact same thing, and I've done it in the morning. I've done it under a barbell, back squatting, and stood up and just kind of gone, oh shit.
And you do another rep, you're like, let me just double check.
I'll just confirm that.
This is, yeah.
And then I think actually put the barbell down and found something else to do, because I was a pathological asshole at that stage.
I benched afterwards. I was like, I can bench. I'm good. Yeah, but you know how it is. It's like you do a rep at 100 kilos, and you feel that little thing happen, and all of a sudden the next rep feels like it's 200 kilos, and you're like, yeah, I should stop.
The common part in that scenario though is that it's early in the morning, and it's under that weight. And I think that was where I really fucked up, in the sense that I wasn't ready to go. I probably, if I'd done that later in the day, I think I would have got away with it. I don't know what, for how long per se, but definitely the early morning just tipped it over the edge for me, because as you say, those discs are pretty vulnerable then. And especially when you kind of treat that workout session as if it's one that you're doing at 6 o'clock at night, when you've had the fullness of the day. So, there's a short kind of progression in your warm up. You're getting under that weight, and man, it doesn't take much to hit that threshold.
Yeah. And I probably wasn't prepared to be squatting the weight that, I was squatting. I mean, in any other given situation, it wasn't a situation where I was tremendously overloading it, right? It was 100 kilos, it was 225 pounds. You're looking at somebody that at one point is, back squatted 430 pounds, right? Comfortably. I used to win weightlifting meets and all that other stuff. But, when the pandemic happened, I got away from doing bilateral back squats. And I'd been building up slowly, and I was like, you know what, let's throw 2 wheels on, see what happens. I've got nice hips, everything's moving, my ankles have been feeling good. And it just happened. And sometimes it does. And in a perfect world, right, if my back were 100% functional, which, I know it's not, wouldn't have caused any issues.
So what do you get in terms of symptoms from this? So I'm guessing you're not getting any like leg symptoms, right?
No, I usually get that kind of deep, achy pain pretty consistently in the PSIS. So if you go and feel your lower back, that little bony spot to the left or the right, get that deep ache there. And then when you kind of get yourself into a flexion episode, you're leaning forward or something, you get a little jolt. Like even today, if I'm leaning forward, it's still a little bit more tender than I would like, although it's not to the point like what it was Wednesday morning when I woke up and I was like, oh fuck, I got to put my shoes on. Or the dog is like, pick me up. I'm like, oh fuck, don't want to do that. So it's cleared up quite nicely. I know that, I've got to go get it cleaned up and get it treated and try to get that function a little bit better. But yeah, I'm doing good.
So you brought up a really good point there about the pain over the SI joint, the PSIS. So that kind of dimple area in the low back. Mm-hmm. Because we know that's kind of like your major sclerotome referral zone for an L5 disc. So if we look at the chart, that's the dark area that you see. And then there's some spillover around that you can get, but that's kind of like your epicenter when you're getting referred sclerotome pain. But it's right over the SI joint, right? So what that kind of leads people to want to do is to go and get that SI adjusted, or to kind of point to it. And so you can be led to think that it's a dysfunctional SI joint and that thing gets slammed. But it's not actually related at that point in time, right? I've had that done several times. And often that adjustment or that manipulation of that joint is is putting you in a position where you're just irritating that disc even more. There's rotation that's happening down there. It's bad news, right?
Yeah. Yeah. And, I guess it depends. Sometimes it can feel really good if you're not in bad shape and you can get that pain relief mechanism to that joint and you can kind of distract that joint. And let's be honest, like, when's the last time you adjusted somebody's sacroiliac joint and you didn't get any movement in L5S1? So if you look at it from like an actual traditional chiropractic standpoint, typically if you adjust that SI, you're also adjusting the segment that's dysfunctional and is actually pain driving. So it's one of those things where you can get lucky, well, not lucky. Well, you can accidentally improve the mechanics of the joint temporarily. That's actually causing the pain, therefore giving you a temporary pain gating effect. But at the end of the day, I don't necessarily think it's dangerous to have it adjusted if you're not getting adjusted by like a drunken gorilla or anything like that. But it's really not fixing your problem, because if it's just gating your pain, now it's going to allow you to actually get into some of those positions where your body doesn't want you to be in and perpetuate that symptom set for a longer period of time, actually go ahead and damage that disc a little bit more and functionally increase the rate at which you'll feel those type of symptoms or have those episodes in the future.
So you did this when? How long ago did this happen?
Last Tuesday, so that's what was that be, the 22nd?
Okay.
So 8 days ago.
I'm kind of getting a week past it now. So
Yeah.
you would have been kind of taking it easy for that last week, just kind of moving around it, keeping a little bit of gentle activity going and just kind of letting it cool off, right?
Yeah. Thursday morning, I because we go work out with this other couple, and it's just as much of like a social event for us than anything, right? Call me crazy for getting up at 6 a.m. have a social event. But what I did is I did some light upper body stuff without no flexion at the hip. I did some dumbbell benching. I did some really, really light braced dumbbell overhead press, which is not bad for me because I've got excellent shoulder flexibility. I did a little bit of ring row work, a little bit of pull-up work, and that was it. I did some ankle flexibility stuff just to kind of groove that a little bit. But yeah, Thursday was what I did. By the time Sunday rolled around, I was like, yeah, I'm feeling better, right? It didn't hurt to put my shoes on or hurt to bend over. Monday, I took off. Tuesday, so yesterday morning, I went back to that place. We do Tuesday, Thursday mornings. And instead of doing back squats, I just did some step-ups. So a little bit lighter in the step-ups. I did step-ups and then an EMOM of like reverse lunges, light assault bike, and I did some core planks, just some regular standard front planks and an EMOM. Worked up a little bit of sweat, got the blood pumping, and that was it. I'm a little bit sore this morning, but mostly just in the glutes and the hamstrings.
So what's good about that is you've kind of stayed away from loading axially, so loading through the spine. You're not really putting any force down through that kind of pelvic area, which is smart. Right. I think especially, and you mentioned the assault bike, which like I love as a strengthening, well, not as a strength tool, but as a conditioning tool, because it's one of those things that you can absolutely bust your lungs to pieces and you can work as hard as you want to, but you're not really loading through the midline so much. So you can have all of your limbs just flying up a storm, but it's really minimal load that's kind of going through that midline, as opposed to like a rower, for instance, where there's a ton of flexion and it's really, really hard on that area. And same with the ski as well, just because you're constantly in that flexion. So sounds like you've done the right things.
Yeah, I mean, we understand. I mean, it happened and I knew the exact diagnosis right away. I know my lower back function hovers between 70 and 80% on a day-to-day basis without super consistent treatment. I know that certain exercises will cause an increase of load on the spine. I know which ones won't. I know my body to the point where, yeah, now is a good time to go in and get some blood pumping in and out. And yeah, I mean, it's one of the advantages of being who we are, is that we understand certain things, even if we can't always find the right people to treat it. So it was just one of those situations where I pretended I was my own patient. You know, I gave myself exercise advice in order to unload that, so this didn't turn into something that consistently happens. I know that I've got to go ahead and get myself treated by Dr. Jeremy in Long Beach within the next week or so. And that's it. It shouldn't be a situation where, you know, this starts happening more frequently. My fiance is joking around. She's like, you turned 30. Now you hurt your back. It's like, I don't think my back's any better or worse than it was a week and a half ago. But it's just one of those things that, you know, I have to stay on top of a bit more diligently, and shouldn't be a big deal.
No, it sounds like you've done pretty good. I could tell you some stories about how to do it absolutely, completely wrong. But it's all in hindsight, I suppose. You know, you sort of mentioned, like, we know what to do, and we know what to do now. You know, I definitely didn't know what to do before. I can think back a few different times where I completely missed the boat. I went into a competition once with clearly a disc that was already had been injured a few times, and so it was not in good shape. I had no idea at that stage what the function of my back was. It was probably very poor. And I went into a competition that involved running, thrusters in one workout. Then the next workout was deadlifts and toes to bar, which are not good movements when you have a very pissed off disc. And so that didn't end well for me. But yeah, it's all hindsight, I suppose. You know, I can look back on that now and kind of go, oh my God, what a dickhead. But you know what you know. So I'm glad I understand things a bit better now.
Yeah, and you're in a different spot from a mindset standpoint as well. You know, for me, it's like CrossFit doesn't really define me. It's not something that I sit there and stress about doing. You know, I'm not trying to be competitive in it. I'm not trying to do this and that. I didn't have an impending competition coming up. I didn't have anything really happening. So it's like I had the mental space to say, yeah, I needed to just chill out for a little bit. And even this week, my volume is a lot lower than it has been. But that's the nature of the beast. You live and you learn. You prioritize different things in your life. And I'm also at the point in my life where, you know, if I can't treat somebody's lower back on a given day because my back hurts, I'm fucked. Right. So it's like there were a couple lower backs that I had to do that I was like, you know, I'm on a pitch clock here. I can't do any more than a couple of these. And that's going to be the nature of that. So, you know, my ability to provide for my fiance, my ability to feed this little bugger here that's sleeping on the couch over there, my ability to provide value to the world is dependent on my body functioning. So it was an easy, it's an easy situation for me. Obviously it sucks. Obviously you want to get out of pain as soon as possible, you know, but with the experience that I have, I knew it would be 5 to 7 days before I was feeling, you know, 80 to 95% better. And it was just getting that last little bit of your back cleaned up and should be in good shape.
Yeah, it's a very good point that you bring up, because it's a very real consideration now, especially in that the importance of looking after our own bodies to be able to look after other people's bodies. It's because I didn't used to think like that. I used to trash my own body really. But yeah, there's big consequences now. So it's definitely something that I'm thinking about. Yeah. And it's completely changed my whole outlook on, you know, working out and physical fitness and exercise. You know, I don't train like I used to, and I'm cool with that. I think I used to probably define a lot about myself through that, you know. And I've had to kind of move on from that. I got forced to move on from that, and that's cool. But you just find a new way to appreciate it, and I spend a lot of time on the bike, on the air bike, because I can still keep a pretty good level of fitness there that translates well into other things that I want to do. And, all it does is it just kind of muscles kind of blow up a bit and then I'm good again. But I'm not loading through the spine. I'm not just smashing myself and getting that wear and tear that I can't undo. So it is a big shift. You still want to feel fit. You want to feel like you can do everything you want to do. You kind of want to walk around and hold yourself in a way that you feel confident and all that. But it is a completely different shift in mindset, and that's okay.
Yeah, and there are certain exercises that you absolutely do not need to do if you are in pursuit of health and longevity and living pain-free to 100. There are certain exercises you don't have to do to have a healthy hormone system. There are exercises that you do not need to do if you want to take your shirt off at the beach and snap heads. And it's like, at the end of the day, why do I actually train? And at one point in my life, it was to be really good at weightlifting. It was to be really good at CrossFit. It was to sit there and say that I could squat 400 pounds. It was to do this and that. At the end of the day, right now, I want my fiance to look at me and still go, yeah, I want a piece of that, right? I want to be healthy. I want to be able to perform my job for a long period of time. I want to have kids and be able to throw a ball with them. I want to have grandkids and be able to throw a ball with them. I want to be able to say, somebody comes up to me, breaks into my house, and it's a battle of my strength versus their strength. I want to be fucking stronger than you. But outside of that, that's it. And there are just certain things that I don't need to do in order to accomplish all of those goals. I don't need to back squat super heavy. You can step up and lunge and get all of that beautiful squat pattern strength from things that don't load the spine so much. I don't have to deadlift. I do like to deadlift, and I will deadlift every once in a while, but I don't need to. I don't need a barbell bench. We can make a bunch of well-informed decisions in terms of what exercises that we want to do when we push our ego aside. And don't get me wrong, we know on this podcast that I love me some ego. I love myself. I'm great. I think I'm great. But at the end of the day, right, I know that ego needs to serve me and serve my actual goals. And being clear about what those goals are and how to accomplish them allows me to say, yeah, I can do this one. I don't need to do that one. I don't need to do that one, right? I need to get fucking 8 hours of sleep at night. I need to watch my body and watch my dietary intake in such a way that, I keep and maintain a stable weight. I don't need to be crazy and count everything that goes into my body because I'm happy with what I've got. So obviously I want to get better every day, but getting better every day doesn't require me to back squat or do full snatches or fucking handstand push-up every other day, or do 100 kipping pull-ups. And again, I'm the biggest supporter of kipping pull-ups out there if they actually align with your goals. But there's just certain things that you don't need to do. There's a lot of fit, dangerous, strong people out there that haven't back squatted in a while. Don't need to bench press, don't need to do kipping pull-ups. Yeah.
Well, we know that being bald comes with a lot of wisdom. And I think that there just kind of sums up this whole podcast, really, because it's all about being pain-free at 100 years of age, and this is one way to do it. So we might just leave it there.
I think it's a good place to end. Say hi to my dog. Her name's Juno.
What's up, Juno?
She's passed out and farting.
All right, man. Well, you enjoy that and take care of that. Take care of that lower back, and we'll see you back in the chair next week.
Our brother. Have a good one.